Good evening and welcome to Let's Talk Facing Fentanyl Together. I'm Tim Pham. I'm KREM 2's morning anchor and Let's Talk executive producer.
And I'm Lisa Gardner, president of the Spokane NAACP. Fentanyl has created a severe public health crisis in Spokane County, with overdose rising dramatically in recent years.
In 2024, there were 353 recorded drug overdose deaths in Spokane County, setting a record high, 84% involving opioids, primarily fentanyl. But behind every number is a name, is a person, is a son, a daughter, a brother, a neighbor, a classmate, one of us.
And that's why for the next hour, we're here to have real and honest conversation. We'll talk about where we're at as a community and what the reality is on the ground. What's being done? But most importantly, hearing from people with lived experience and believing what the solution could be.
Tonight is not about pointing fingers. It's about Spokane coming together to face the realities of the most urgent issue impacting our community.
And before we begin today, let's go over tonight's format. We'll have two panels, and we have the first one up here. The first one will feature people who are directly impacted by fentanyl. They've lived through it and know firsthand how it's hurting families, young people, and neighborhoods here in Spokane and beyond.
Then we'll hear from community stakeholders and leaders, people that have a seat at the table with a position to create change. They're here not only to listen, but also to hear from you and answer your questions about what's being done to help make our communities safer and healthier.
And for our live audience, you can submit your questions for each panel throughout the evening. If time allows, at the end of the evening, we may take additional questions.
Before we get to our panels, we want to take a moment to talk about how we got here, not just as a community, but also where we physically are right now at Gabriel's Challenge. We want to invite up Katara Johnson here in just a minute. Katara Johnson is the founder and CEO of Gabriel's Challenge. Gabriel's Challenge is a community-driven initiative here in Spokane that was launched after the loss of Katara's 24-year-old son, Gabriel Fensler, who died from a fentanyl overdose in March of 2025.
And in the midst of her unimaginable grief, Katara discovered a 66-page plan that Gabriel had written before his death. A vision for a more compassionate, community-based approach for helping struggling people with addiction and mental health challenges.
Since then, the vision has sparked real action in Spokane. We're talking community summits, outreach efforts, community care kiosks right here inside Gabriel's Challenge, and a storefront inside Northtown Mall. Katara has become the leading voice in this conversation and a powerful advocate for change in this community.
So, without further ado, let's give a warm welcome for Katara Johnson.
Yeah.
Thank you, Tim and Lisa. And thank you to everyone for bringing this conversation together tonight, and for all of you who have shown up today. After finding Gabriel's plan, it spoke to me deeply. And I immediately began working to carry that vision forward. And although I lost my son, I have raised so many more sons right here in this very location. And some of them are here tonight. And it happened because we are in a place of accessibility where we can meet people right where they are. Gabriel's Challenge was created as a community-driven effort focused on prevention and connection and closing systems gaps so people can access support without barriers across the continuum in systems of care. What many youth and young adults or families are experiencing right now is not just one challenge, it's multiple systems that are often difficult to navigate during moments of crisis. We have a system that was made to navigate when people are brought. And oftentimes where a lot of people are navigating when they are not. Many young people are moving between behavioral health systems, emergency rooms, schools, housing instability, recovery systems, public health systems, and sometimes the justice system without a coordinated support effort or clear pathways forward. And when systems are disconnected, people fall through the gaps. And those gaps are costly emotionally, financially, and oftentimes tragically. The data continues to show increasing challenges connected to behavioral health crises, emergency room visits, domestic violence exposure, arrests, trauma, school disengagement, and instability among youth and young adults in our community. But again, tonight is not about blame. It's about recognizing that this work is way too complex for any one organization, any one political party, any one agency, provider, or family to solve. It's about working together because it requires stronger connection, collaboration across healthcare, behavioral health, education, public safety, recovery supports, public health, and the community. Because people closest to the challenges are often the ones closest to the solutions. So tonight is about listening, it's about learning, and moving forward together. Sometime.
Thank you, Katara, for sharing your story and for showing us what it looks like to truly turn something so painful into purpose. Your leadership and your courage, we are just so grateful for what you do for our community.
And thank you for reminding us why this conversation matters. This issue touches every part of our community, and tonight is about listening, it's about learning, and hopefully moving forward to solutions together.
Our first panel tonight are people who have experienced the fentanyl crisis deeply, very personally, through addiction, through recovery, loss, or advocacy.
And now we know we're going to hear some stories tonight that might be difficult, but they're important. And we're grateful for each of our panelists and their willingness to openly speak about their addictions.
When we come back on Let's Talk Facing Fentanyl Together, we will hear from people directly impacted by the fentanyl crisis here in our community. Welcome back to Let's Talk Facing Fentanyl Together. We begin our conversation tonight with people who know this issue, maybe unfortunately, I should say, too well, because they've lived it, they've been impacted by it, and in some cases, they've lost people to it.
All right, so let's introduce our first panel tonight. The first person we have is Kayla Krause, a psychiatric nurse practitioner at Bloom Psychiatry with experience supporting veterans and individuals navigating the behavioral health and substance abuse challenges. Her work focuses on connecting people with compassionate care, recovery support, and medication-assisted treatment to help improve long-term stability and wellness.
Please welcome Daryl Myers. Daryl is a peer support advocate who is living a life far removed from his past addiction and now works to help others do the same through mentorship, outreach, and lived experience.
And we're also joined by Nicholas Viscara. Nicholas serves through a local street outreach ministry and brings lived experience and community perspective to individuals experiencing homelessness, addiction, and barriers to support.
And finally, joining the panel is Tony Lodge, CEO of Native Project, an integrated healthcare organization serving Indigenous communities.
We appreciate all of you for your willingness to be open, honest, and vulnerable in front of not just this audience, but a live audience, in the entire community tonight. These conversations are not easy, but again, they are very important.
And we want to remind everyone here tonight to remember this is a conversation about understanding. It's about hearing experiences, learning from one another, and talking honestly about what fentanyl is doing to families and communities across Spokane. So with that, let's get to our first question. And Gail, I want to first talk to you. As someone who has transformed your own life and now helps support others through recovery and peer support, what do you wish people better understood about how connection and support can change someone's path?
So connection, support. Unfortunately, too much in any community, we see a lot of, like Mr. Pham said, somebody's family member, somebody's uncle, aunt, brother, sister, mom, dad. You know, we kind of see that. It's like, I mean, not to be, not to be disrespectful to anybody in the community, but I often too much see it. Then like, they don't matter, right? And they matter. There's women. It's a crisis that matters. Like, people need help out here. And, obviously, from my lived experience, a big thing is, fentanyl isn't just fentanyl. They're putting fentanyl in a lot of different drugs, too. And it's dangerous. It's a very unfortunate thing. But where we could turn the unfortunate thing about it into something good is through support, through help. Too often, people get sent to the county jail, and that's where the help should be at, right? I mean, you go to the county jail, that's where the help needs to be offered. And too much that happens too much, you go to the county jail and you just get let out. Or you go to the county jail and the medical isn't enough, right? I think they should offer that resources in the county jail to help the recovery process. So it's very critical. In my opinion, it's very critical for support and help. It needs to stand large from the county jail. There needs to just be no other options. Where it starts. So.
Thank you. Now, Nicholas, this next question is for you. Through your outreach work and lived experience, what are some of the challenges you see people facing when they are trying to find stability or support?
I go off a relation of experience, and so for me, 25 years I spent, you guys, in addiction, homelessness in Seattle, and it was trying to even go into a emergency room and having no ID, no insurance, and they see you as a homeless person, but you go in there saying, that I want help. Why is it so hard to get help? And you get turned down, because you don't have an ID or insurance. So a lot of these people out there, theft, they lose those items. So it's hard to find help, let alone a lot of the places I'm finding when I'm out there on the streets, it's trying to just connect with them, but then to get their story, but then I share my story, which then turns into an encounter. I'm a strong believer in Jesus Christ, and it's the Holy Spirit that takes over. and it's meeting them where they're at, and then having a conversation with them, sharing my story of hope, and then you try to call a facility, and we don't do intakes on weekends. People's life is like seconds away from a fentanyl overdose. You guys, I was into a heroin, opiate addiction, 15 years, 25 years of everything. I literally got out of the fentanyl thing right when it started coming in. I overdosed. I was an IV user, and I overdosed 3 times in 2 months. I'm like, what is happening? There's something going on. By the grace of God, the gospel is what saved my life, you guys. And when I'm talking to these people on the streets and ministering to them, I cannot find them a bed. Or you call places, well, they don't have insurance or they don't have this, and it's difficult. So what I'm running into, the programs at work, I want to shout out to Adult Teen Challenge. It's meeting people where they're at. No matter your situation or what you've been through, it doesn't matter if you have insurance or an ID. They'll help you get that while you're in the program. It's what saved my life, you guys. I'm going to a little story here. First, I want to honor Katara, her obedience, you guys. If I wish something was like this around when I was going through it. This is huge. This is what's making a difference. Jesus was the hands and feet that walked in community. When this is right here, we're all just people and humans. We all have our own beliefs and ways, but it's coming together as a community that makes a difference, you guys. There's resources, there's powers, there's finances. It shouldn't be like, oh, we can't finance because it's faith-based, you guys. The percent rate of programs at work is faith-based. So these programs that we're not going to take you because you don't have insurance, there's resources, but we got to come together as people. I lost 25 years of my life, but I'm going to fight to the end to help young people don't have to go through what I went through. We're losing people every day. I think it's 200 people to fentanyl overdose a day in America. This epidemic is taking over, you guys, and it's just, it's not just like he said, the street people. It's the businessman, it's a pastor, it's everybody that is struggling with these addictions. And it's when we got to stand in the gap and be the voice of hope and meet people where they're at and not beat someone down because they're down. Like there's people that drive by and they're so concerned about the second someone's eye, not even looking at their own log in their own eye, and they start judging. But who are you to judge that man on the street? Have you ever gotten his story? So I encourage you guys, next time you see someone out there struggling, I've been out there and I've heard some rough stories, especially with women, what they have to go through, but what got them to that point. I don't need to get in details, but we can put it together, and they've been out there, now they're selling themselves to support a habit. It's demonic, and it's got to stop. But sorry, I'm kind of going to rant there, but it's good. You guys, it's just... What happened for me, this was 2019. I was downtown Seattle. I was seconds away from taking my life. I'm doing enough heroin to go to sleep and just be done. My family hadn't talked to me in years. I was all alone, and this van pulls up. No idea what was going on. And they get out, they hand me, it was Thanksgiving, a hot meal. I know last time I had a hot meal, especially turkey. I love turkey with gravy. But not only that, it was raining cold that day. They put brand new socks on my feet. They put a blanket around me, but the thing that mattered the most was they told me I was loved. Even at the worst point in my life, they didn't even know who I was. I probably stunk, looked gross. You guys can see in that look that they have what I looked like on the street, my mugshot, it was rough. But the thing is, what happened is they planted a seed that was in me. I may not have gotten sober that day, but you know what? I am here. And what saved my life is the gospel, because that's what they gave me, and that's what I believe in, and that's what changed for me. I don't press it on nobody, but I'm telling you, Jesus is the ingredient that we're missing in most of these treatment centers nowadays. He is the root, and he is the one that can set you free. I'm a living experience. I've tried 18 treatment centers, nothing worked. I've done 3-day detox, 5-day Suboxone. I've done the methadone clinic. All that is putting, not even a Band-Aid, it's digging you deeper into addiction. That's even worse than the actual drug that you were doing. I've got 7 months of withdrawal coming off of methadone, you guys. It's overused and overgiven. It's destroying lives, and it destroyed mine. But now I live today 7 years, 100% sober. And I live to be out there on the streets, but it's more than that. Like it's everybody. and to reach them, because every soul in life matters. Doesn't matter your race or what you're going through, your story matters, because never in my life did I think I'd be sitting here at a table like this, you guys. But I give that glory to God.
Thank you, Nicholas and Gabriel, for sharing your testimonies. So powerful. I want to transition now to ask Tommy a question. Tony is the CEO of the Native Project. Tony, according to the Spokane Regional Health District and the Washington State Overdose data, American Indian and Alaskan Native communities are experiencing disproportionate fentanyl impacts. So from your perspective, what solutions are urgently needed for Native youth, families, and communities?
Well, thank you for inviting me here. I'm a member of the Turtle Mountain Chippewa tribe of North Dakota, and I've lived in Spokane for 46 years, and I'm an urban Indian. This is my tribe now, is how we live in the cities. And at Native Project, we do treat people of all ethnicities, and we are the only BIPOC healthcare provider and clinic in Spokane County. They say that tobacco, alcohol, marijuana are the gateway drugs. Those are not the gateway drugs. Trauma is the gateway drug. Trauma is what puts us here. Trauma is what keeps us here. And Native Americans have 536 years of trauma in this country, as do many, many other groups of people. And we don't really have good methodologies for treating trauma, and maybe our healthcare provider down here has more. But as a healthcare provider myself, I'm not a doctor. I just pretend to be at lunch when I hear the doctors talking about what they're doing. But I hear. A lot of people come in our doors for a lot of different reasons, and it's not always that they're homeless. It's not always that, they've had these long stories of addictions. Some of them have had to work really crappy jobs in their life, back-breaking, in the fields, in the orchards, just doing things that made your body wear down. And that's where a lot of the people in our community get started using is just because of the jobs that they do, and that they were not able to get relief any other way than with painkillers. And I love Dr. Velasquez, he's my good friend, but doctors are not really trained, and I supervise a lot of doctors in my clinic. They're not really trained in addictions. They're trained in treating your pain. They're trained in relieving your pain. They're trained in wanting to help the patient. And sometimes that's maybe not the best thing that the patient knows. I also run licensed substance use and mental health facility for adolescents and children. And the kids in our program are ages 10 to 17. Our kids in Spokane County are 10 years old to 17 years old in our drug and alcohol programs. We are the only outpatient adolescent treatment center, public treatment center in Spokane, and that should scare everyone in this room. That we have one provider in Spokane County that does outpatient alcohol and drug treatment for kids. Again, trauma is how we all get in the door. We're 10, 12, 14, 16, and you walk in the door with trauma and fentanyl and freedom to smoke your grandma's marijuana. I've never seen more pissed off parents in my treatment program when they come in and their kids been into their stuff. I'm not kidding. Not that the kid's using, but they're into their stuff. So we have a community and a culture where it is okay to use. The other thing that I've done treatment for 45 years. I with my friends started a treatment program because we were tired of Native kids being the winners in all the loser categories, which it sounds like we're still the winner in that loser category. And it's a race to the bottom in our community sometimes. And we just we gotta manage this ourselves. And I agree with you about in my 45 years of doing treatment, well, two things. One, doctors prescribe to the law of thirds. When you are dealing with disease. And I've learned this from the doctors that I've worked with in the last 45 years. You know, a third of the people that you deal with are going to die from their disease, whether it's chemical dependency, whether it's cancer, whether it's diabetes. They are so sick, they're going to die from their disease. A third of the people are going to go back and forth, in treatment, out of treatment, whether it's cancer, diabetes, or chemical dependency. And a third are going to either have spontaneous recovery, or they're going to get it the first time you do chemotherapy with them. They're not going to have cancer anymore. And so for me, I never know which patient's coming to my door. Is it the one that's going to die? Is it the one that we're going to see for 10 years treating the same thing? Or is it the one that's going to get it and get on down the road? I don't know, but I know how treatment works. If I didn't believe treatment works, I wouldn't have took a $100 bill with my friends and started a treatment program that's been operating for 45 years. Treatment does work. And when we had that state opioid conference here, and we had a panel of lived experience, every one of those people said, I got better when I went to a really good treatment center. I'm like, there it is. People said what it is. But I agree with you that there has to be practice of, I call it spirituality by the numbers. Do 4 directions, do 10 commandments, do 12 steps. I don't care. Do something spiritual that enhances your physical, mental, emotional treatment of whatever disease you have. I mean, cancer, diabetes, or chemical dependency. And the last thing that I know for sure, doing this for all these years, is that the goal of treatment, the goal of drug and alcohol treatment, is to return the person to the community from which they came. And we forget that. We think, oh, we're going to get new teeth, or they're going to get a better personality, oh, they're not going to be so obnoxious, they're going to buy into Christmas, you know, all kinds of outcomes that we wish for people in recovery. But the goal is to put you back in the community. So we got to support families. We have to support neighborhoods. We have to support churches and VA hospitals and all the things that people out in recovery or after treatment go back to the mall. We got to support the mall in being a place for people to go to. That's what we're working for. Life that matters, a path that matters, and a community that will embrace you instead of saying, oh, they're an addict. Right now, as a federal contractor, I can't hire a lot of people I want to hire because they have a charge, or they have they can't pass the FBI background check that Indian Health Services makes me do. I mean, there's so many barriers to returning people to the community from which they come. But anyway, I've really enjoyed. I enjoy every single kid that's coming to my program for treatment. I see them at Zips. They're yelling through the window, hey, Tony, remember me? You were my counselor. I was never their counselor, but if I was there, they think I'm their counselor. I see people working at the casino. I see people working in the mall. Treatment works. Treatment works.
Yeah, that's our Aussie Tony. Thank you, Tony.
I tried.
The next question is from Kayla, and as we remember, she is a psychiatric nurse practitioner. Yeah, there's still many misconceptions about medication, assisted treatment, and recovery support. From your experience working with individuals navigating substance abuse and behavioral health challenges, what do you wish the community better understood about how these treatments can help people stabilize and rebuild their lives?
Thank you. I think it's just so important to know that there are treatments out there and available for people. There are a variety of medications, treatments. It's not one size fits all. Sometimes people have to try multiple things to kind of get the right fit, but we do know the medications work. Like medications for opiate use disorder can be incredibly effective. They lower the risk of overdose. They lower the risk of death. Sometimes it helps people get on their feet until they can taper off the meds if they want to. Some people stay on the meds forever, and that's okay. Some people need insulin forever. Some can get their diet under control and can get their blood sugar lower and stabilize like diabetes. So it's not a one-size-fits all. And I think if we as family members, friends, community can be supportive with helping people find what works for them and be flexible with sometimes when it takes a couple different times, or 18 times of treatment or whatever it takes, as long as we keep those doors open, as long as we continue to support our loved ones and let them know we love them and serve them with dignity and respect and validation. Because even with the substances, even with the drug use, they're in there and they feel how you treat them. I think that's something that some places are really trying to shift in healthcare because people have been traumatized from accessing healthcare in the past, and trying to access care and not being able to receive it or being traumatized from that experience makes it harder to go back in and ask for help again and be vulnerable. So I think it's just so important to know that sometimes, faith-based works, sometimes medication works, sometimes a combination works. But no matter what approach works for someone, they need support. They need connection. And so we just know also, we used to think, that medications were like treating one addiction for another. And now we know that's not true. Substance use disorders are a chronic illness. Like she said, sometimes it's kind of the law of threes, right? Some people get it right the first time. Some people have this kind of ongoing struggle with it. Some people are able to quit and stay off later. It just really depends on a whole bunch of variables, really. But the medications really help stabilize the brain chemistry. So that gives someone an opportunity to work on a whole bunch of other things, dealing maybe with trauma, getting into treatment, getting into therapy, stabilizing housing. There's a whole plethora of other things that often go along with substance use disorders and mental health issues. And it really helps to work on stabilizing them together. And being able to take medications without family telling you, well, you're still addicted, or, the medications are just a crutch. Nope, the medications are treating an illness, and that's how we help people get stable so they can kind of work on their goals and get better. And then last thing, so as far as opiate use disorder goes, in Spokane, we do have lots of great programs. The three medications that we have for opiate use disorder are methadone, buprenorphine, and naltrexone. So methadone is only through opiate treatment programs. They're very specialized, federally regulated facilities. And so they have a little bit more stringent guidelines, a lot more kind of requirements, hoops to jump through kind of. For some people, methadone is very, very effective. It's been around a really long time. For other people, it's not so effective. Other options are buprenorphine, so that's like your Suboxone, Subutex. We also have long-acting injections of the buprenorphine medications down, so someone can come into a clinic or ER or whatever and get a weekly shot or a monthly shot that then helps manage those cravings, helps manage opiate withdrawal, helps them kind of feel better, feel stable, not have to take medications every day. And then the third one is naltrexone, and that one is just like a blocking medication, and there's like a daily pill for it, or there's a long-acting monthly injection for that one also, and these are available in our community. Deaconess ER right now is doing a kind of trial with one of the long-acting injectable buprenorphines. So they're able to give that to people in the ER, like if they're coming in with withdrawal symptoms or maybe are brought to the ER post-overdose, just to give them some of that stability for that week, so then we can get them connected with an outpatient clinic in the community and get them stayed on the meds, work on the other mental health stuff, work on other substance use issues. So we have lots of opportunities to make things better if we're connecting kind of our collective efforts and helping people get connected with the services that they need that are going to work for them. Thank you.
All right. Thank you all. Can we give them a round of applause? But we're not done talking yet. When we come back, we'll have more from the panel and we're taking your questions. So stay tuned. Welcome back to Let's Talk. Facing fentanyl together. Now we're moving into our Q&A question. We have our first question here. How do you support families who are trying to help their loved ones? Or what supports are available for families as they support loved ones?
See, I think there's very little support for families. The way our insurance companies are set up, there has to be an identified patient, and that is the sickest person in the room, not the person that can offer the most help. So a lot of what we need to do is restructure highway paying and support families financially on that they can go to. We haven't even imagined yet what the best family treatment or family support programs are, because we're so focused on the sick person. We're so focused on the person with, again, cancer, diabetes, or addiction. And it's like, how do we do this as a circle? And not just the family, but the neighbors and the neighborhood and the schools and all the people that are around that person that needs us. So again, I think the financial restructuring of insurance, the program designs. I know there's brilliant people that just haven't had time to think of this because we're so busy doing this other stuff. But I think it is the unknown in true recovery for people. I wholeheartedly agree, Tony. I don't know anyone that's so emotion without a family, and that's extremely difficult. Something you're going to post to keep dress over there, but acting with the right hairstyle. I take remember things. There's strategies, there's frustration, there's attitudes. Oftentimes they're looking at syllables up in the dark of it as I was at a local condition that was causing some of the reasons why I person continues to show up in that space. And as a family, what supports that, I didn't even know where to start when Gabriel, I found out he was using. I didn't know who to talk to, where to go, because we often don't talk about it because of the stigma. I've seen people who say, I lost my son or I lost my daughter, but they never really said why. And I think that was really critical to open my mouth and be honest about losing my son to fentanyl so that we can have like open conversation about this thing. And when it comes to family, we have a system that treats a client, like individual, we have schools that treat the student and that suppress the students. We have a jury system, a justice system that treats that speaks to it. But they are not individuals. They have people connected to them. We start looking at a person as an ecosystem that even changes things. And cannot should be able to get their treatment with their family. When providers don't talk to the family. So as a mom, I'm the one who say, well, who's my apartment? It was me waking up every morning at 5:35, driving my son to another clinic every morning, which I don't feel was even, that's sustainable. You think about now, about the gas prices are low. Can people still go to treatment as they don't pick up the medication or it's not sustainable. It's not a sustainable practice. And so what I talked to our sheriff, our county sheriff, and he said, did you know where to start? He said, my daughter was using, I didn't know where to start. I said, I didn't know where to start. And I work with a healthcare agency. I didn't know. And so I found addiction work plan funded by a local nonprofit here in our region, Race Redeem. And I'll share that website to so many people. It's the most user-friendly. And I said, how do you maintain this? And I talked to her. She said, because Katara is personal for us. When there's a child who loses a loved one, it's personal. It's not a you or him or whose name is on a brochure. It's personal because it's our family members, it's our community members. We have to show up for love. And we're going to have their privacy differently. Right. Yeah.
This next question is directed to Daryl. What is being done to reduce deaths in post-incarcerated period? You talked about this. What is happening in therapeutic drug court?
So learn about me and like family. Not by addiction. Well, I was just a scared little boy turning into an angry young man. And I've done over half my life incarcerated. Started with smoking weed. Started smoking weed at 11. And I was introduced to methamphetamines at the age of 15. And I guess crime was the outlet. So, started at a young age, got locked up the first time when I was 13. And man, spent all my 20s, majority of my 30s incarcerated. Was never out till that. But when I was out, the street drugs, I used marijuana a lot. But the street drug out there at that time, and I was using methamphetamines, and I got, I got out this last time I got out. I've been doing good for 2 years. I've been doing great. The time before that, well, actually, people were telling me, there's fentanyl in that mess. And I didn't know I didn't really know what fentanyl was. And then the come down was different, and I tried to get clean multiple times. And it was a different thing. And I was like, yeah, that's what they're talking about. So, I never outright used fentanyl, but like I said, it's a dangerous thing to put fentanyl on everything. There's stories of kids smoking weed and dying from the fentanyl that's in the weed. It's in cocaine. But so anyways, this last time I was blessed with they offered me drug court, therapeutic drug court through Pioneer Human Services. I want to give them a shout out. It's been really saved my life. Really, it's the compassion, the love, down from Miss Zambling to Judge Zambling down the line, prosecutors, peers, main clinical one-on-ones. It's just like I love the compassion. It's a great program, and like you said, with treating does work. It's not just about like this panel is about right now. It's about everybody coming together as one, whether it be through it starts first with compassion and love, and that you matter, right? That you're not just some drug addict that wasn't a kid that wasn't raised, that wasn't innocent, right? At one time, and like Nick said, meeting people where they're at. That's treatment does work. It really does. Spread through drug court. I truly believe it'll save my life. And I just want to give Pioneer Human Services a big shout out. If it wasn't for them and the compassion and love and treatment that they provide, I wouldn't have done it. Sorry, I don't know if the microphone was cutting out. I wouldn't have made Katara. Katara's amazing. I wouldn't have met Trey over here with my guy Trey. Thank you. I live doing helping at-risk youth because I was at-risk youth once a year. I didn't have that help. And Katara does amazing things here. Like she said, she's gained some science, and she means that she is amazing. It's just a blessing to have her. So, yeah, it's amazing. Like I said, it's in my life, and shooting guns work, shooting all dogs work, but it starts with love, it starts with compassion, it starts with you matter, reach out. It's okay to make mistakes, and it's okay to be honest. When you're honest, that's the piracy, right? You know, when you're honest, they show that they cared and then that they honor that. So yeah, it's in the works, man. It's amazing. They're doing training hard. The Sunset for 30-year mark, and they haven't been around for 30 years for nothing. Great organization. And it's, like I said, it stems with the treatment that they provide and the care and the love that starts all that. So it's a blessing.
Thank you so much.
That problem.
Now, yes. In the essence of time, this next question is for Nick. So, and really quick, what would you suggest to help struggling persons that are out there with addiction?
Is that like as being the person in addiction?
That's the question.
First, you got to see people as people, not a project. A lot of times I've had a lot of people see me as like I'm a science fair project. How can they fix me? What can they do to make me better? But really for like a person that's struggling, it's community. Things like this, get them involved. Like I said, treatment works, but you have to be willing to go. You have to sacrifice and be done. For me, I was burnt out. I had multiple felonies, cops looking for me, all my hustles were gone. And I was done. I was like, this isn't fun anymore. I got to the point where I'm like, this sucks. Like, this is not fun. Because in the mix it was, but when all that stuff's gone, it wasn't as fun anymore. So you have to be fully willing to commit and just be done with it. But for me, it's being around community people that are going to support you in all ways. And like I keep saying that, to meet you where you're at, you know, and be around people that have been through it. That's why I love programs, once again, like Adult Teen Challenge, because when you do get into a program, I highly recommend being in one that you're around counselors that are not book knowledge filled, but people that have been through it. Because like I'll ask the counselor, have you ever smoked a cigarette? You ever drank a beer? No. How are you going to connect with me? You know, I've been through some trauma. No medication's going to cover that. It's a root system that's deep that needs to be pulled out. So for a person that is struggling, if you're struggling here, come talk to me. I'll pray with you. But stay plugged in. Get around people that, you know, they say change your people, place, and things. Sometimes that's good, but next thing you know, you find yourself going back ministering to those people. So I used to believe in that, but I don't now, because it's an opportunity to go trying to help somebody else get help. So just get plugged in with good people. Places like this. This is amazing with Qatar's Junior. Gabriel's challenge. This is huge. I know he's looking down from up above saying, where mom? You know, this is fantastic, you guys. So just get around people that really care about your well-being. You know, like I honor my wife. She never been around a person like me before, someone right off the streets. You know, she used to drive by and judge those people. Now she sees them, she sees my face, because I was that person out there. And it's just being around good, solid people that really want to see, that want to public good out of you. You know, it's just sometimes you got to change where you're at, you know. And yeah, I think I hope that answers your question.
Thank you. And thank you all for sharing your stories. You know, it's usually hard to talk about this thing, but we appreciate your honesty, your vulnerability. We're not done yet. We still have one more panel. After the break, our next panel will come up to talk about responses to this crisis and possible solutions. Welcome back to Let's Talk Facing Fentanyl Together. Our second panel tonight brings together leaders from across our community, people who shape policy, public health, public safety, and the systems responding to this crisis every single day.
And as we continue the conversation tonight, we want to acknowledge something important. There are no simple answers. We may not agree on every approach or every policy, but we can all agree that this crisis is impacting lives across every neighborhood, every background, every race, and every generation.
And it's going to take all of us working together. We're talking families, educators, treatment providers, law enforcement, healthcare workers, elected leaders, and community members to move towards meaningful solutions.
You know, this panel is an opportunity to talk honestly about what's working, where gaps still exist, and what accountability and action should look like as we're moving forward. Joining us tonight is our Mayor of Spokane, Lisa Brown. She has spent decades serving the community in leadership roles at both the state and local level. Throughout her career, she has focused on issues including public health, housing, economic development, and community safety.
Also with us is Representative Suzanne Schmidt. Representative Schmidt serves Washington State with a focus on public safety, behavioral health, education, and strengthening outcomes for children and families. Her work emphasizes practical solutions, accountability, and bipartisan collaboration to address complex community challenges across Washington State.
We're also joined by Dr. Francisco Velasquez, Spokane County's health officer. Dr. Velasquez brings decades of experience in medicine, public health, and community health leadership. His work focuses on prevention, behavioral health, and collaboration, improving community wellness throughout data-informed and equity-centered approaches.
And joining the panel as well is Judge Gloria Ochoa. Judge Ochoa has dedicated much of her career to public service and the justice system in Eastern Washington. Her work focuses on accountability, community safety, and connecting individuals with resources that help address underlying challenges, including addiction and mental health.
So, with that, thank you to our panelists for being here tonight and for being willing to have this conversation that's sometimes necessary, sometimes difficult. But let's go ahead and dive in and get into our first question.
Mayor Brown, the first question is for you. You can move the stand too. There you go. Mayor Brown, what does building a healthier and safer Spokane look like when it comes to supporting youth, young adults, and families facing behavioral health and substance use challenges?
Well, thank you for inviting me here tonight. I am the mayor of Spokane, but I'm here as a mother. Qatar and I have connected over a mother's heart. And I'm also a family member who has addiction, mental health challenges, and incarceration in my family. And I think the reality is that almost all of our families do. Certainly all of our 29 neighborhoods do. And so this needs to be an all of city, all of region response. That means for the city of Spokane that this isn't just one piece of the city, but we have our Housing and Human Services Department, of course, involved, but also our police department with co-responder teams, and our fire department with co-responder teams, parks, libraries with the opportunity to create educational and programming and activities for youth. It's got to be an all of city response. And we started with that. In the last year, we've been able to create an outreach team organized by police precinct. Now, those outreach teams are every day now, but they're not 24 hours a day, so we still have gaps and work to do. We have a navigation center, but just one, and it's open during the day, so we have more work to do there as well. And we have emergency shelter, and the city didn't have the resources to actually do that on our own, so we partner largely with faith communities who have stepped forward to provide the spaces, and then we have providers that work and with the folks in the emergency shelter. We have found that having peers people with lived experience is a really important part of the process because, as you heard everybody say in the last panel, meeting people where they're at is really key, and having people who can talk to them many times based on their own experience is really key. So in addition to that, this requires this region-wide response, and so partnerships. And so across the aisle, the city has worked with the county on expanding those co-responder teams. And those are the kind of partnerships that need to keep going. When it comes to youth, there is a huge gap. Tony and Katara have convinced me that we have not done near enough on the prevention side and on the side of supporting families and youth in crisis. And much of that is a hidden crisis because it's going on maybe not out on the streets, but behind closed doors. So we've got to reach out and do more of that. So one of the things I wanted to say tonight is really inspired by you, schooled and educated by Tony. The city's next investment of opioid dollars, and those are dollars that came from lawsuits for opioid manufacturers that were irresponsible in the utilization of those products, and they were taken to court and are now paying local governments and states to help address the problems that were caused. So our next allotment of opioid dollars we want to dedicate to youth prevention and youth treatment. No, thank you. Thank you, because this is a gap. The city has been engaged with providing services and contracts for people who provide emergency housing for homeless youth and for homeless families. But prevention and treatment is a gap in our system. And so this next, the next round of funding that we have, we will utilize in this way. Thank you. You're welcome.
Thank you. Now, Representative Schmidt, what role do you believe that the state and local partnerships need to play in improving solutions for youth and young adults across Washington state?
Thank you. And thank you for giving me the opportunity to be here this evening. A big motivation for me coming tonight was to hear where things are working and where they're not working. And so with that, I think it is the state's responsibility to work with the cities and the counties to make sure that we provide those services that are going to help the people where they're at and identify them. And I think that's something that I'm definitely looking for, is how do we identify what is working, what's not working, because I do believe that there's been, at least at the state level, legislation that's been passed in the last few years that has unintended consequences. And one of the things I'm going to bring up, because it is the youth program, because of some of the youth having protected rights with healthcare, that actually limits parents from being able to get help for their children. Don't have access to that information, nor can they speak on their behalf. And I think that that's something that we really need to look at. I've had a few friends, and myself included, that have had experiences where if you found out that your youth was using, they wanted help, and how do you do that? And if you do have private insurance, then is your private insurance going to talk to you or talk to your child? Is your child going to want to go through with the process of getting the help? So there's some things that I think at the state level that we really need to look at more closely and fix. So that, because I think that sometimes we create barriers, with unintendedly, we didn't intend to create those barriers, but we do. And so when we identify them and we know that they're stopping people from being helped, I think that's our responsibility as state legislators, and then also as our, our county and city, to look at those and figure out how do we fix that so that we can remove those barriers and that help is available. And I do know that we do see, youth as there is a big gap. Finding help for them, and I was talking about youth that have parents or family that are trying to get them help, but there's also the youth that are living, on the streets and going from shelter to shelter, and it's really difficult for them to get help as well. So I'm really happy to hear that you're going to be putting that money towards youth, because I think that is a big gap that we absolutely need to address. But that's what, as a state, and I'm going to just say this as a state representative. So we go to Olympia, we represent the constituents of our districts, our area, and what we do is we actually write laws. We write bills, legislation that helps our community, or at least I would say that most, that's our intention, is to help the community and help the people in our community. And when we know that there's a fentanyl crisis, that means it's our responsibility to go back to Olympia and figure out how can we address this. How can we address this issue, not just with the treatment, but stopping the actual circulation of fentanyl in our communities. So we need to work with law enforcement. We need to work with the state and the federal government to stop the actual, the trafficking of drugs in our community. That's one thing. I think that's our responsibility to do that for our citizens. Our responsibility is to keep them safe. And if we can't keep you safe, for sure, we want to help you when those situations do happen, when you are in a drug crisis. We want to be able to get to you and help you. And I do think that, some of the responding teams, the first responders, those are really helpful. And to have those peer contacts, those are really helpful. And again, so those are things that we want to look at, is like, those are working, so let's do more of that. Some things are not working, so let's do less of that. And really, listen to people. And again, that's what I'm here for tonight, is I really want to hear what you have to say, what's not working and what is working, so that I can take that back and work with that. Thank you.
Thank you, Representative Schmidt. Dr. Velasquez, from a public health perspective, what makes these challenges so complex and interconnected for communities right now?
Thank you. I'm happy to be here today. I'm actually here as a health officer, but as a member of the community and new grandparent over the last 5 years, 3 grandkids in Spokane, which is the reason we're here and staying here. And one of the reasons why I'm so passionate about this, because the youth that is in front of us is the future, and if we don't invest and protect them, what's our future going to look like, right? So that's a question that I ask myself every day. And like a good physician, I wrote some notes, but now I cannot read my handwriting. In medical school, we take 6 months of lousy handwriting is required. But I want to do 3 things. Let's talk a little bit about the complexity of the issue, which we start typically with defining what the issue is. And I've learned a lot about this issue from a lot of people that are here and a lot of people that are not here today. And then after that, I want to end up with a couple of positive notes, because I'm an optimist, so I always like to end up in a positive place. So what is substance use disorder? There's a lot of definitions. I'm going to share with you mine. Mine is a chronic relapsing brain disorder. Notice that I'll say brain disorder and I'll define what that means. That is usually the result of convergence of a lot of issues that are around genetics and environment and developmental issues of the individual. I haven't used substance yet, right? I haven't talked about substances yet. Now, when that happens, there's significant consequences from mental, behavioral, and physical health of the individual, but there are also significant consequences because of the morbidity, the mortality, and the disability on the family, the neighborhood, the community, and the society, which is also a significant economic burden, right? So the reason why I bring that up is because this is a big societal issue with complex individual components. And we have found it. whether we know it or not. And unless we'll own it, we're not going to fix it. So that is kind of the definition. What are the complexities? And I think Tony alluded to that, and some have alluded to that. When we talk about prevention, intervention, treatment, recovery, there was a myriad of issues related to that. Everything from, somebody mentioned IDs, we shouldn't think about that. You know how complicated it is to get care if you don't have an ID? By the way, we have a problem with the permanent licensing to get people to get IDs because of that. But it could be housing, it could be transportation, it could be nutrition, it could be access to health care. It could be, I don't know where I need to go, or it could be that I go somewhere, but that doesn't connect me with the next service that I need. Because particularly on the treatment and recovery side, is a very complex network. And one of the things that I need to do a little bit better as a community, I do have to say, as a community, we're really trying very hard. And we do have some successes, so kudos to our successes. But we need to connect those dots. And we need to roundly transfer people from one place to the next, to the next, to the next, to the next, which doesn't happen 100%. But if we were able to learn 75% of that effective work, you will see a significant reduction in pretty much everything. And I've heard about correction facilities in the conversation. I've never slept so long until about 5 years ago. And I've been to the county and the jail. So it's up to the tops there, which I really haven't known unless I was a health officer. And one of the things that I realized is this is a community member that is in transition. Yesterday I was out here, tomorrow is in here, then day after tomorrow is going to be back in the community. So what we do while they're there is going to impact what happens when they come out. And one of the downsides that we see now is that that's a drop off. You come out, but there's nothing there. So you end up back. It's a revolving door. And this is not a criticism, that's something that I have learned. And that is just one of the many, many, many complexities of this issue. So from a public health perspective, because we have all of those pieces and all of those gaps, it is a significant concern because it impacts the health of the community in addition to impacting the health of the individual. And that's what we need to work on. So let me say a couple of positive things, if I can. Yeah. So positive thing number one is what's happening here right now. We have a cross-section of the community from every level of life. Some of us may not have ever met each other unless we were here, right? But we're here. And we're here because we want to make a difference for someone that we may not even know, right? Or maybe for someone that we know. So that's positive number one, and this needs to continue because this is the way we fix it. This is the way we solve. I think the mayor made a great point. She learned from someone about need, and with her role, she goes like, well, I'm gonna address that, right? Which is what happens, is a connectivity between all of us. Second positive, which I'm always very happy when I see that, is we have, including that 3-week old, I don't think he understands me yet, but we have a lot of youth here. My friends over here that were singing before the show started. That is the future, and it's our responsibility to take care of the future, correct? So I'm going to end with something that I think needs to be said. Since fall of last year, September to be exact, to first quarter of this year, we have seen a significant reduction in a few things that are very important to remember. One is the number of lethal overdoses, which basically tells me that things of that kiosks and a few other things and the partnership with the libraries and the partnerships with others are helping. Reduce mortality. We haven't cured the issue, but at least we have reduced the mortality. We've also seen a significant reduction in the number of emergency room visits, and as you pointed out, the job of an emergency room is to patch you up and send you out. Because that's what I did before. We'll see a reduction in that. That's not the best place for somebody to be when they have a mental health crisis, right? And the third one Yes, we've also seen a reduction in the number of emergency medical services being called out to reverse an overdose, which basically tells me that a lot of that is being worked on by our elected officials, our business leaders, our faith-based organizations, our community organizations, our nonprofits. It's making a difference. So the question is, how do we amplify that, right? How do we enhance that to a point where instead of a 30% improvement, is a 95% improvement? So that's what I'm here for here today. And I'm very optimistic that by coming together like this, if anybody can do it, Spokane can do it. Is that correct?
Yes.
There you go. It was so that you believe it, actually. All right. So thank you very much for the opportunity.
Judge Hara, this next question is from you and from your perspective. What have you seen about the intersection between behavioral health, trauma, and justice involvement that communities need to better understand?
So, I guess first, I kind of want to preface that I'm a strong believer in diversion. If emergency rooms are not the best place for mental health crisis, the jail is not the best place for those people that are experiencing, trauma and crisis. Those are the most expensive ways to handle somebody that is having that usually co-occurring substance use disorder impact in their life. So for everybody else that's outside the criminal justice system, I highly support and encourage efforts to continue on diverting as many people out of the emergency rooms and out of the jail. So I just want to lay that as a foundation. However, where my work centers around is I picture a Venn diagram where you have homelessness, you have substance use disorder, you have chemical dependency, and then you also have public safety, criminal activity, criminal justice that actually impacts real people. The people that I work with are in that core center where they're intersecting all four spheres. And what happens a lot is people look at it, it's just homelessness, or it's just substance use, mental health, or it's just crime. That's all it is. And it really is a hybrid of all those four things. And most of the people going through the criminal justice system, I think there's a study like 60% plus co-occurring mental health, substance use disorder issues that are in the jail. And so what I look at it as, since you're already here, so if somebody has already become criminal justice involved, there are public safety. We have to balance that also with the person's rehabilitation. So I'm always very mindful that some of the individuals, even though people call it low-level crimes, are committing a lot of low-level crimes that are impacting a lot of people too. And all of us benefit, the individual benefits by being rehabilitated, but so does the entire community, their families and our neighborhoods and our cities. We all benefit from that person's success. And so my perspective is that the jail is, unfortunately, it's part of this bigger picture of those four circles: the homelessness, substance use, chemical dependency, and public safety. It is part of that. I consider it a tool. The jail is not a solution. But one of the things that I'm seeing is I've been in criminal justice. I was a prosecutor, I was a defense attorney, now I'm a judge, I was a trial court judge as well. And in 25 years, I've had clients and people that I worked with that have gone through the methamphetamine, the heroin, even the Oxycontin era. But I've not seen something like this yet. I think somebody here alluded, people who are impacted community members alluded to, fentanyl has changed the landscape. There is no longer these windows. The window of a person having the cognitive ability to make informed decisions about their well-being is just such a small window. And that is where options like medically assisted, those other options for somebody to have that opportunity to not immediately go into these, what I understand to be extremely painful withdrawals that are overpowering, and people are just going from one to the next and don't have that window to see what am I doing with my life. And so from my perspective, I think it's important to factor in, yes, all of these solutions for diversion, all of these community-based, yes, but not to forget that in the center of all of that, all of these, the Venn diagram that I described, there is
the criminal justice system and the jail and public safety, and we do have to care about the well-being and safety of everyone in the community. And how can we capitalize and use that not as a punishment, but as an opportunity to intervene? And that's what I tell people that come before my court. Since you're already here, let's make this an intervention site. Let's use this as hopefully a reset. Let's get you connected. And that's something that one of the reasons that I'm in municipal court is because as a municipal court and district court judges, we do our supervision locally. So everyone that's in our system is going to be in our community. I can work with them through our probation office, getting people connected. That's what I would like to do more collaborative partnerships with the community to connect people that are already in the criminal justice system. But we need to work with them. Whereas if you're a superior court judge, people get sentenced to prison sentence and go off to the Department of Corrections. You don't get to see them for years usually. And so the reason I'm so excited about this, and I'm just so grateful that Qatar started this movement about having a holistic approach of how we're dealing with this as a community, because it is not just a criminal justice issue. It is not just an emergency room issue. This is really a community problem that impacts everyone, and it doesn't discriminate. It doesn't discriminate against who it impacts. There's people from all walks of life, our socioeconomic backgrounds, our religious needs that are being impacted. And so I see this as an opportunity, as a call to action for us to work more collaboratively on a holistic approach to dealing with the fentanyl crisis.
Thank you, Judge.
We're not done with this panel yet. When we come back, our panel will be taking our audience questions coming up next. Welcome back to Let's Talk Facing Fentanyl Together. We have our panel still up here taking questions from our live audience. Our first question is for Dr. Velasquez. Dr. Velasquez, we've talked a lot about the brain and the impact on the brain and decision making, but let's dive a little bit deeper into this. Obviously, it's complex and we don't have like images and all of that to be able to explain the differences, but can you talk to us a little bit more about the changes in that time frame?
Sure, let's talk about that a little bit, because I think it's one of the misconceptions that we've had for many years, which is, okay, don't stop because you're on Waldo. Well, I'm going to prove to you that you can't. So first of all, fentanyl is the most addictive drug that we've seen since I've been practicing, and probably before that, I was blind. And it really hijacks your brain. It hijacks the happiness response. Your brain is meant to make you feel happiness over things. So when you eat a great meal, you feel good. When you see a beautiful body that smiles at you, you feel good. So as a human being, what makes you feel good, so your brain is tuned up to do that. So fentanyl hijacks that response and plants it. So to feel happiness, you need more. And you need more. And you need more, and now, and more, and more, until it gets to a point that there's so much more that you can do. And one of the things that we know in this physiology studies for that, your prefrontal cortex, where decision-making, inhibition, the sort of cognitive functions reside, it actually changes that so that there is function. Which basically means you can't really make decisions. So Qatar was talking about trying to navigate the system, but that function is not working anymore. And as time goes by, it has a significant impact on your memory centers. So then you can't even remember. So it's not like you want to, it's that physiologically and functionally, your brain has been totally rewired. And that chemical rewiring takes months, if not years, to reverse. So I wanted to mention that because that's the main reason why I started by saying there is a chronic relapsing brain disorder, because your brain has been hijacked, rewired, and totally changed. And to get it back to where it needs to be takes a long time. And I'm glad that you asked that question, because that's one of the things I couldn't read in my handwriting. Thank you.
All right, this next question is for our Mayor Brand. Mayor, how is the city measuring success of the investment of the opioid dollars?
So I would give you two answers to that. One way we measure success is to actually measure the outcomes of each of the different nonprofits or activities that the city is engaged in. And one thing I have to point out is that that's not always under the city's control, because we get federal dollars and they have certain requirements or strings attached. We get state dollars. Usually the state dollars are even more connected to our outcomes because we communicate with our state legislators more easily, but still they have strings attached about what they can and can't be spent on. And we really have very few local dollars because Spokane is not a wealthy city with a lot of taxpayer dollars to put into this. The county has mental health dollars. So we've got to communicate and coordinate. And one way of measuring outcomes is to literally ask and contract with the providers and measure how much success they have. So I'll give you one example. We did not have much success with people in a big warehouse shelter. It just didn't work very well. In actually having them navigate to pathways of that were stable and successful for them. The smaller scale model with no more than 20, maximum of 30 people in one place, and usually people that have some of the same, have similarities in their situation, like maybe one of our shelters is all women who have had domestic or sexual abuse in their life, and another one is for like an LGBT population. So we measure the outcomes, and those smaller environments work better. And then the other thing that is not statistical, but I think it makes sense, is when you get the city and the county and the state on the same page, and you get Democrats and Republicans on the same page, then you probably hit on something that's successful. And I'll give you one example of that. Maddie's Place. Maddie's Place serves infants that are born with addiction and their families. And that is a model that really is growing and successful here in Spokane. And the county has got on board with that. The city has got on board with that. The state has got on board with that. Democrats and Republicans have gotten on board with that. And to me, that's a model of success. That's a homegrown, community and family-based solution. And we have many of those, but we need more.
Our final question.
Practice what is a in the Alliance loans, if a standard has a diagnosis or disability, they cannot be suspended if it's related to that. Why not in healthcare? In healthcare, in Washington State, just like Gabriel, being released from treatment for minor issues or taking their kicked out, but it's costing a lot of lives. What can we do in the state to make sure that we have a law that prohibits organizations from kicking out individuals in treatment for the very reasons in which they came there to get treatment for? And I ask this because we just had the county health officer say that the price on the court test is no longer there. So how can her kick somebody out after doing one of these like Gabriel diet? And I've heard someone done a little bit longer, and they'll end up passing away. That is costing lives. It's very expensive. So what can you do at the state level to address those things? I can look at the legislation that would change that, but I think what we first have to do is look at those particular situations, get more information about them. Like I know you have shared with me about Gabriel and being kicked out of facilities, and I've heard that from other folks. And so what we really need is to have those stories, those instances of how it happened, where it happened, what was the facility that they were in, because we need to look at it. It may not be something that we have to change with state law. It may be something, a policy within that particular agency, maybe a policy within that municipality, it may not be a state piece for state legislation, but what I would say, you know, and that it's the most important thing that as a legislator, that I would say is, you know, hearing those stories and reaching out, and don't ever be afraid to reach out to us, and don't think that we don't have time to listen, because we need to make time to listen. But until we have those examples of when that happened and how it happened, it's hard to pinpoint and then find, you know, right legislation that would change it and help families. But I would say again that I think that, you know, our intention when we are making legislation, or we're making, you know, we're writing bills, policies, our intention is always to be helpful and to keep the community safe, and to provide the services that our community wants. But those things happen, and that's what we need to look at, those individual situations again and get that information. Tell the stories to your legislators, to your mayor, to your county commissioners. I know before this started, I was talking to some people in the audience here, and we were talking about one of the things that, and I do know this, that I've heard this on several occasions, that we have a delay in services. So if somebody came to you, like Dr. Velasquez was saying, you know, their brain is kind of mush, and so if they have the conscious thought at a moment that, yes, I want to get sober, I want to, you know, I want help, we need to be able to get that help immediately, not going through the process of, well, let's, you know, fill out for Apple Health or Medicaid or get their ID. I mean, I think that those are the things, you know, and that we need to do after the fact. What we first need to do is they want help, but listen to that and be able to provide that. And how we do that is by listening to situations, when it's happening, how it's happening, and then also what are the situations that are working. You know, if we do have somebody on the street, you're doing outreach, and someone wants help immediately, and you've been able to find someone about, or find them, you know, a facility or help treatment, then share that as well. Because we need to hear those stories. We need to be in touch with you. But that's what I would really encourage all of you. And thank you so much for coming tonight and for listening and for bringing your questions. But I really encourage you to reach out to your legislators, your mayor, your county commissioners, your health officer, your judges. Reach out to us, because we really do care. We wouldn't be in public service if we didn't care. And we really do want to find those solutions. But you are the people, you know, you're the boots on the ground. You're the ones that have the solutions, and we need to hear from you so that we can actually put those solutions in place.
Thank you so much. Thank you so much. All right, we're going to Mike. Thank you all for your honesty and for all the work that you do in community and for being with us tonight. Can we give them a round of applause? Yeah, we know that this issue goes beyond each of you. It goes out and beyond. And it's going to take a lot of work, and a lot of work for all of us together. So we're not done yet. After the break, we'll talk about where do we go from here and how do we turn this conversation into action.
Good.
Dog stops, the handheld is a member clear. It's important that we invest in prevention and community-based care so people can receive care in their own neighborhoods and communities. It's important that we advance a well-rounded approach so that people can access support without falling through the cracks or getting lost in disconnected systems. The work here is too complex for any one organization or system to solve their own. It will take real collaboration, accountability on behalf of all of us, and a long-term commitment from all of us. And while tonight's conversation is learning the work as well. Thank you for listening. My name is Katara Johnson-Jones.
Thank you, Qatar, for those powerful closing remarks tonight, for your vulnerability, for your leadership and your courage, and for creating a space like this. We really do appreciate it, and how you've been able to turn your loss into action and hope for others. Thank you.
Now, tonight we've heard difficult stories. We've heard some frustration, some heartbreak, and some hard truths. But we've also heard about resilience, compassion, and a shared desire to do better as a community.
Conversations like this are not always easy, right? But they're necessary, because the fentanyl crisis is not someone else's problem. It's all of our problems, because like we've heard from our panelists, this is impacting our families, our schools, our neighborhoods, and lives all across our beautiful city.
And while we may not be at one simple solution, tonight showed us something important, that people from our walks of life are willing to come together, listen to one another, and be a part of the conversation.
And we want to thank all of our panelists here tonight. We sure do appreciate it. We want to thank our volunteers, our production team, and everyone here tonight in the audience for being a part of this important discussion. And especially, we also want to thank those of you who are watching at home for spending your evening with us and engaging in this important conversation that affects so many people in our region.
And if you or someone you know is struggling with addiction, mental health, or substance abuse, please know that there are resources and people that are ready to help. Asking for help is not a weakness, and no one should face this alone.
Spokane, thank you for being here tonight, for caring about this issue, for caring about each other, right? Thank you so much. And we do want to say from all of us here at Let's Talk Facing Fentanyl Together, thank you and good night.